Dr. Marvin James Farr was born into an America where neighbors were willing to die for their fellow citizens. But he died Tuesday in a very different country, one where many of his fellow Americans refused to wear a piece of cloth on their face to protect one another. He was preceded in death by more than 260,000 Americans infected with COVID-19. He died in a room not his own, being cared for by people dressed in confusing and frightening ways. He died with COVID-19, and his final days were harder, scarier and lonelier than necessary. He was not surrounded by friends and family, his son wrote in the obituary posted on the website of Price & Sons Funeral Home. Farr, a farmer and veterinarian, was born in 1939 into an America recovering from the Great Depression and about to face World War II, times of loss and sacrifice difficult for most of us to imagine, Courtney Farr wrote. Americans would be asked to ration essential supplies and send their children around the world to fight and die in wars of unfathomable destruction. He died in a world where many of his fellow Americans refused to wear a piece of cloth on their face to protect one another. Farr graduated from Kansas State University in 1968. His careers filled his life with an understanding of the science of life, how to nurture it, how to sustain it, and the myriad ways that life can go wrong. As a young man he debated between studying mortuary or veterinary science. He chose life over death. The obituary continues. The science that guided his professional life has been disparaged and abandoned by so many of the same people who depended on his knowledge to care for their animals and to raise their food. Farr was religious, a man of his community, and a family man, both of blood and chosen family, his son wrote. He was active in social organizations that did good work for the Shriners Hospitals for Children Network. He was also a lay reader at church and saw no conflict between the science of his professional life and the belief of his personal life, each enriched the other. From religion, he especially drew on lessons of forgiveness and care, Farr wrote. He would look after those who had harmed him the deepest, a sentiment echoed by the healthcare workers struggling to do their jobs as their own communities turn against them or make their jobs harder. He would also fail those who needed him the most at times, as he was still human, with his flaws and limits.